Welcome, distinguished guests, faculty, please seat. Thank you. Welcome, distinguished guests, faculty, friends, and senior nursing students to the Spring 2013 pinning ceremony. I am very happy that all of you could be with us on this very special occasion. Each pinning ceremony has its own special meaning for the students, the faculty, and the families. We are celebrating both the completion of one journey and the beginning of an exciting new professional journey. All 52 pre-licensure graduates will now serve our community and promote the profession of nursing with competence, skill, integrity, and caring. Our 10 RN to BSN learners have responded to the Institute of Medicine's call for 80% of our nursing workforce to be BSN educated by 2020. They are true leaders in our field. All 62 seniors are ready for graduate school, some of which have already started in our new FMU MSN program to become family nurse practitioners or nurse educators. As of tonight, as an independent program of nursing study, Marion University has graduated over 500 baccalaureate nurses to serve the PD region over the past 7 years. And tonight, we are proud to add 62 more to that number and to congratulate them with this traditional pinning ceremony. The Marion University Department Nursing Pin signifies our core values: commitment, competence, and caring. We know that the graduates will wear their pins and represent the profession and the department with integrity, honor, and pride. It is my pleasure tonight to introduce the special guests for this occasion. Dr. Fred Carter, President of FMU, Dr. Richard Chapman, Provost, Dr. Peter King, Associate Provost, Dr. Jeanette Myers, Assistant Provost, and Dr. John L. Bruce, Vice Chairperson of the Drs. Bruce and Lee Foundation. Now I would like to introduce Dr. Fred Carter, who will provide us with some opening remarks.
You know, on behalf of the university, our trustees, faculty, staff, and students, I'm delighted to extend a warm welcome to everybody here this evening. This ceremony, which is held prior to commencement every single semester, is an opportunity to celebrate the academic achievements and accomplishments of our students here tonight. And yes, as our prayer giver pointed out, it is a celebration this evening, okay? So we expect to see a lot of smiles on the part of everyone here this evening. You know, the leadership of this university is especially pleased that the vast majority of these nurses will remain in South Carolina to pursue their practice, with a substantial percentage, about 80%, remaining in the PD region of South Carolina. Let me be frank with you. That's exactly why this program was created, to get more nurses in this state, to get more nurses in this region. As a matter of fact, it was 10 years ago this month that this university began the process of establishing this BSN program. We acquired an appropriation from the General Assembly. We acquired scholarship support from the Drs. Bruce and Lee Foundation, McLeod Health, Carolina's Hospital System, the Marlboro Charitable Trust, to name just a few, amounting to hundreds of thousands of dollars in scholarship support. And that support has continued over the past decade. We also received $10 million in contributions 6 years ago to build the Frank Lee Nursing Building, which is located just across the way and is one of the finest nursing buildings in the Southeast. We're very, very proud of that institution. This past January, with a generous appropriation, another generous appropriation from the General Assembly, we added graduate degrees in nursing practice and nursing education. In the fall of 2014, about 15 months from now, we hope to have 3 dozen third and fourth year medical students from the USC School of Medicine who will be studying with our nurse practitioners and our nurse educators, hopefully in a new building downtown, $15 million or so, that we hope to have supported in large part by the Drs. Bruce and Lee Foundation. And in the fall of 2016, we anticipate adding a physician assistant program to this very, very fine collection of healthcare degrees. And by the way, he was introduced earlier, but let me take a second and recognize Dr. Johnny Bruce, who sits on that Bruce and Lee Foundation and has been one of the strongest proponents of this nursing program in the entire region. Dr. Bruce, would you stand up and let us recognize? Johnny, are you comfortable? Do you need a pillow or a blanket? Because I got 15 million reasons to make sure you're feeling good this evening. Shameful, isn't it? Now, let me be real honest with you. What's the reason for the success we've had? Well, don't be misled. It didn't come about as a result of the initiative of a handful of people. This success is due largely to the quality of the students that matriculate into this program. Not just quality in terms of their intellectual capacity, and by the way, they have that. Have you tried getting into a nursing program lately? Hell, have you tried getting into this nursing program lately? It's not easy. But also with regard to their compassion and their willingness to devote a lifetime of effort and service to others. You know, it takes extraordinary people to do these extraordinary careers. And those extraordinary people are sitting in front of us this evening. And my friends, we couldn't be more proud of what you are and what you represent. So let me close by extending my compliments to the faculty for another class successfully graduated. My congratulations to our graduating nurses, almost, and my thanks to everybody in this audience for sharing this special ceremony with us this evening. Thank you.
Thank you, Dr. Carter. Next, I would like to invite Dr. Karen Thompson, the chairperson of the pinning committee, to introduce the rest of our speakers.
Good evening, and I want to congratulate you all also. This was no small task for you to be here today. At this time, I would like to welcome Mrs. Shanna Lee up to the podium to give the address from the Alumni Association.
I would like to address you on behalf of the FMU nursing alumni. We would like to first congratulate you on your accomplishments, but we know because we were in your shoes not too long ago. To be exact, 2007, part of the first graduating class here at FMU. Very proud of that. This is probably one of the longest journeys you've ever traveled, but one that is very worthwhile. We also know that at this moment you are still worried, not about ATI anymore, but about boards, and for finding employment for many of you. However, we hope that you will find some time in the future to join us in providing support to other future BSN nurses as yourself here at FMU. This support will not only reach to future graduates of the program here on campus, but in the communities where we work and live. Again, we are proud of you and we welcome you as FMU BSN nurses as well as FMU alumni. Take pride in being a patriot.
And now I would like to invite Dr. Gerard Jabali to come to the podium for the physician's address.
Greetings, President Carter. I'd like for you to know that I was asked to speak briefly, and for a Jabali, that is going to be an accomplishment. I'm very pleased to be here to celebrate this wonderful, wonderful opportunity and sense of accomplishment. As a proud father, I can tell you I share that with all of your family members, all of your extended relatives who are just very, very pleased with what you've been able to do. And my congratulations. I'd like for you to know, too, that I'm also a very proud medical educator. I've been on the faculty at the residency program for 32 years. And while great accomplishments have been achieved by you, there are great challenges ahead for you. I would like to focus on one very briefly. The Institute of Medicine said that we can have a safer healthcare system and that we can improve the quality of our care. That there are over 1 million unnecessary deaths in American hospitals each year. Now, how is that possible? How could that happen in America? We have magnificent medical science and technology advances. We have curative gene therapies and all the wonderful things that you see in the hospital with robotics and medical advances, and they're publicized to the lay press. We certainly know what to do, don't we? The question is, do we really know how to do it? Now, I am very old school, and those on the faculty who've known me forever realize that I am a very intimate, up-close, old school, face-to-face kind of doctor. And my question is, what happens when I make rounds today? What happens when you go into a hospital? I see physicians with their faces in a computer, and nurses with their faces in a computer, and therapists with their faces in a computer, trying to document all of the facts that we're required to do. How is this affecting the quality of care and the safety that we're empowered to uphold? There's ample evidence that our technology is improving the disease states, but the unintended consequences are that millions of people are dying as a result of maybe we're not talking to each other. The Institute of Medicine is clear. We have to have a safer system. We have to improve the quality of our care. How do we do this? We have to improve transitions and handoffs. We have to reduce disparities, and we have to increase integration at all levels. It sounds like a call for teamwork to me. The math is simple with teams. 1 + 1 is 6. It's never 2. The traditions of doctoring and nursing have always stressed high touch and high tech, just not separately. Fundamental leadership from you, the graduating class, can make a big difference with improvements in healthcare. You're empowered academically. You're also empowered to be leaders wherever you serve. I'd like to leave you with one thought, and this is from a giant of a woman, Mother Teresa. She once said that none of us ever do great things, but we can all do small things with great love, and together we can accomplish wonderful things. I want you to remember this. Small things, together, and with great love. Thank you.
Now I get to introduce our keynote speaker. On occasion, rules are broken. Usually the person who breaks the rules prays that they made the right decision. During the summer of 2007, Dr. Sylvia Lufkin broke a rule by hiring our keynote speaker without speaking to the faculty and having faculty input, which is the norm. But according to Dr. Lufkin, Ms. Meltzer came out of nowhere, or perhaps, more appropriately, was an answer to a prayer. Regina Smeltzer moved to Darlington, South Carolina with her family from the state of Ohio in 2007. She received her RN in 1972 from Samaritan Hospital School of Nursing, where she was the class president. Her BSN in 1989 from Ashland University, graduating magna cum laude. And her Master's of Science in Nursing in 1991 from the University of Akron, with an emphasis in healthcare administration. Her education offered her many leadership roles, from being a head nurse on a med-surg unit and eventually being the director of nursing at 2 healthcare facilities and the director of nursing at a county health department in Ohio. She has also been an educator at many levels, from training nursing assistants to becoming an assistant professor at Ashland University School of Nursing, and eventually an assistant professor here at Francis Marion. Many of her career activities involve the creation of new programs, which is why Dr. Lufkin hired her immediately. Ms. Smeltzer has been the predominant creator of our RN to BSN program. She has taken what was just a desired program in 2007 to what it is today, a successful program adding more BSN prepared nurses into the PD region. I'm pretty sure I can speak for the entire nursing faculty and forgive Dr. Lufkin for her infraction of the rule, for she made the right decision. Those of us who have worked with Regina have witnessed a great leader at work and an exceptional role model of professionalism. Unfortunately for our program, Ms. Smeltzer has decided it is time to retire. We will all miss her terribly. As chair of the pinning committee, I attempt to have quality speakers that represent role models of nursing and who will inspire you to your greatness. I know I have made the right decision tonight. I hope you all have the opportunity to work with and be mentored by such a fine nurse and leader. It gives me great pleasure to introduce our colleague, my mentor, and somebody I am happy to call my friend, Assistant Professor Regina Smeltzer.
Unless you think that I am this paragon of perfection, I'm not. That was all bogus. I'm just a normal person like everybody else. And I've struggled to be a registered nurse for 41 years. It's been a long haul, and it's time to turn over the helm to someone else. In 1972, yes, there was a 1972. In 1972, I graduated from the Samaritan Hospital School of Nursing. Back then, schools of nursing preferably were diploma-based, hospital-based, 3 years. I was given this pin. I was not given this pin, I earned this pin. 3 years of hard work. You can relate to that. I wore this pin every day that I was on duty as a registered nurse. This pin testified to everyone who saw it that I met the credentials, that I had what it took, that I was a registered nurse, and I wore it with pride. In 1989, I went back to school. I earned the second pin, this one here, from Ashland University. A lot had changed from 1972 until 1989 in nursing education. Part of what had changed was the move from hospital-based to academic-based. And so I completed my bachelor's degree, I can relate to you guys, at Ashland University and earned this pin. I wore them both, and I still do wear them both, with pride. Everyone who sees them knows I did what it took to become a professional nurse. I have what you need, and I can deliver on those words. The 41 years that I have been a nurse, I have seen healthcare change dramatically. I have been a part of this change at times, fostering new ways of delivering care, new methods, new procedures, and so on. At other times, it felt like healthcare was spinning out of control. And I sat there watching my profession and watching my practice and watching healthcare morph in front of my eyes, feeling as though I was helpless to do anything about it. But that's not true. There's a lot of things that you can do. You're just beginning. I'm just ending. There's some things to be said about endings. They're kind of cool in a way. Oops, sorry. I get another. Kind of cool in a way. One of our nursing researchers, you'll recognize this name, Martha Rogers. She once had a quote. She said that there is such a thing as accelerated evolution. The faster things change, the faster the next change will happen. In my 40 years, I've hardly been able to catch my breath. I feel sorry for you. I can't even imagine the pace that you're going to have to keep up with what's going on. If healthcare in the nursing profession is undergoing huge changes in the next 40 years, I challenge you to be part of that change. Not to sit back in your chair, but to be a world changer. Be a changer, be a mover, make a difference in the world around you. Let me share with you some of the things that were happening in healthcare in 1972 when I graduated. This is what it was like. We didn't have nursing research. If we did, I didn't know about it. We didn't have theory. Nobody cared. We didn't have evidence-based practice because we didn't have any evidence to base it on. We didn't have nursing diagnosis. We wore white uniforms, we wore caps, and we were female. Sorry, guys. There were no such thing as nurse practitioners in 1972. The state that I practiced in, Ohio, was 49th out of 50 states to give nurse practitioners prescriptive authority. So you can imagine in 1972 where we were in the whole nurse practitioner era. No one had ever heard of them. Doctors controlled healthcare. Doctors said when a patient needed to go to the hospital and when they were ready to be discharged. Nobody told them what they were supposed to do. Everybody smoked. It's just how it was. Abortions were illegal except to save a mother's life. That's just the way it was, period. That led to a lot of problems. Nurses, you'll find this interesting, I think. Nurses in 1972 were fearful of caring for cancer patients. In 1972, we weren't real sure how cancer was spread. We thought we knew, but we weren't positive. The only treatment for cancer in 1972 that was being used in my area was a little bit of radiation that you implanted and 5-FU. That's all there was. And so nurses were afraid that they would take cancer home to their families, that they would somehow contract it. It was a major issue when we admitted a patient with cancer for nursing care because nobody wanted to care for these patients. They were afraid. People in 1972 didn't die at home. They died in hospitals. There was no hospice. There was no living wills, no advance directives. And if you happened to die at home, and the squad was called to take you to the hospital because that's where you had to go. You couldn't die at home officially. They had to do CPR. It was part of their protocol. They were forced to do CPR on somebody that had died that needed to die until they got them to the hospital. That was 1972, but we thought we were pretty cool back then. You know, we liked what we were doing. We thought we were doing a good job, and sometimes we tried to make changes, but they didn't always work. I gotta get another prop. Oh, this is a funky one. I think I planted some tomatoes that look just like this the other day. Anyway, here are some things that happened along the way between my 40 years of being a nurse and that point and getting here. The first thing that I remember, and a lot of things happened that I didn't remember, but the first thing that I remember was Roe versus Wade, 1973. And I think the reason that I remember Roe versus Wade, this is the whole legalized abortion issue, for those of you that don't know, the reason that I remember this was I had just finished caring for a terribly, terribly infected young woman who died because of a back alley abortion. You know, you hear stories about the coat hanger abortions. They're true. Sadly, they were true in 1972. So in 1973, when Roe versus Wade became an issue, it was headline news, and it was something that I paid attention to. Did you know, when we're talking about legalized abortion, that birth control pills, that we take for granted now weren't available for married women until 1965. All right? It wasn't until 1972, the year I graduated from nurses training, that the pill was legalized for unmarried women. So we had a lot of back alley abortions in the early 1970s, and they weren't pleasant. In 1970, this is going to surprise you, in 1970, we were officially in a healthcare crisis. That healthcare crisis remains today, even though we have tried 10 times with 10 different plans between 1972 and today, 2013. We have had over 10 different plans, Obamacare being the last one, to resolve this healthcare crisis. And I'm leaving, I can say this. I still don't think we resolved it. All right. Oh, Congress, they started passing legislation. They passed something called Managed Care Act. I didn't much care, it didn't impact me, and I didn't pay any attention to it. You know, I was busy doing my thing, raising my family, doing excellent nursing care, running my unit, doing all those wonderful things Karen said I did. I was busy doing those. I didn't much care about managed care. Oh, get away with it. All right, 1983. The first thing that caught my attention, 1983, DRGs. DRGs scared the bejeebies out of me. It was the first time that I paid any attention to healthcare legislation. In 1983, DRGs all of a sudden was going to say, physicians, I'm sorry, you don't have control anymore. We, the DRG gods, are going to tell you exactly how many days your patient can be in the hospital with whatever diagnosis you admit them with. So number one, you better be smart about your admitting diagnosis, sharpen up. Or your patient's going to go home sooner than you want, and isn't that too bad for you? But we're trying to get a control, a handle on healthcare costs, and this is how we're going to do it. DRGs, all right? We were sure in 1983 that we were all out of jobs. Hospitals were going to close, especially the little hospital I worked in. We were all going to lose our jobs. Patients were going to die left and right. It was going to be the end of the world as we knew it. It didn't happen, and DRGs is still around, and a lot of other things aren't. About the same time, a good thing happened. The World Health Organization declared smallpox eradicated. The only reason I remember that, and the only reason that made me happy, was I didn't have to get my kids immunized. That was a nasty immunization. However, about the same time, give or take a few years, by 1982, the CDC sent out another message. This one wasn't as good, and this one was very scary to us healthcare practitioners. They were calling this a increasingly common collection of symptoms. They named it AIDS. They didn't know what caused it. They didn't know how to cure it. They didn't know how it was spread. They had some ideas, but it was affecting mostly our gay and lesbian population. 1982, remember, we're not here. 1982, the gay and lesbian population was still in the closet, very much in the closet. Pregnancy outside of marriage was criticized. Antibiotics still killed staph and strep. Don't want to make this all gloom and doom. But this was a terrible, stigmatizing issue. Nobody wanted to address it, nobody wanted to talk about it, and certainly if you had an AIDS patient admitted to the hospital, not wanting to care for those cancer patients, whoa, nobody wanted to care for the AIDS patient. Happy news, about the same time, hospice came along. You know, people were still dying in hospitals, they weren't allowed to die at home yet, we had never heard of hospice. It came to our community. I proudly, Karen didn't mention this, it's one of the things I'm proudest of. I was able to help hospice come to Ashland County in Ohio in 1983, and it was a wonderful boon for our population. During this time, I also found out something about myself that I didn't know. In 1985, I found out just how much patient rights mean to me. In 1985, we had patient rights, and I was willing to go to jail rather than violate patient rights. And in fact, The sheriff was walking in the door, and I was sitting in my chair, wondering if he would handcuff me or if he would allow me the dignity of walking out of the building unhandcuffed. Whenever someone followed him in the building, waving my release. How much will you give up for patient rights? How much will you give up? In 1980, I was halfway through my graduate program. In 1990, I learned my biggest academic lesson. I learned that it's more important what you learn than what grade you get. That's a very long story. It has to do with Martha Rogers. It has to do with being cool enough to actually call her on the phone, expecting to get her secretary and I could leave a message, and she had the nerve to answer, and then I had to talk. She invited me to come and spend a week with her at a nursing conference to be her helper, and I did that. And because of that, I was able to write a healthcare proposal that I submitted to NASA, along with my application to be an astronaut, because at that time, we were going to Mars, and I could walk without a cane. And they accepted my healthcare proposal. They rejected my application. We never got to Mars, but I have a feeling if we ever get there, Obamacare will be left in the dust, and it will be smelter care that goes to Mars. Alrighty. I share all of this with you not to bore you, not to amaze you at how far we've come, but to make a point. I have lots of balloons. To make a point. Those are the things that have changed in healthcare in my 40 years. It's your turn now. It's your 40 years. 40 years from now, I'm going to come back. And I'm not going to be so old that I'm going to be dead yet. And I'm going to hobble down these steps. I'm going to sit in that chair. And I'm going to listen to one of you give the graduation address on your retirement. And you're going to share all the things that have happened over the past 40 years. And the students are going to say, man, she lived in the dark ages. I am going to say, way to go, good for you. Way to go, good for you. You are going to have to deal with things like legalized suicide. It's going to happen. It's going to be addressed. Are you going to voice your position, or are you going to let somebody else make that decision on legalized suicide? What about late-term abortion? Those are issues you're going to address. You can sit down and not address them. Somebody will. And the decisions will be made, or you can take a stand. What about healthcare rationing? You think that won't happen in our country? Let me tell you, it's happening already. It's happening already. Very simple example, flu vaccine. A few years ago, we didn't have enough. We had to decide who to give it to and who not to give it to. Healthcare rationing. What about inequities in healthcare? You've studied that. I don't need to even address that. In 40 years, our statistics in inequities in healthcare have not changed an iota. They're still as bad as they were 40 years ago. That's deplorable. Children in our country today, 57% of them are uninsured. You will need to address that. You need to take care of our kids. You need to do something. Then we have Obamacare. I don't know what the future holds for healthcare in our country. I don't know what direction we're going to take. But I do know that you're the ones that are practicing nursing right now. You need to be up on the issues, take a stand. You need to make a difference in our world. For some of you, world will be the patient in front of you. And that's fine. There's no better world than the world of your patient. Let me give you an example. You may not even know that you're changing a world. You know, I can imagine these planets, and it's not going to happen that way. You're going to change somebody's world, and you're not even going to know it. I was working in public health at the time, and I was coming back from a meeting, and I got out of my car, and this Polynesian woman with the biggest fruit basket I have ever seen in my life, it had to weigh 50 pounds, approached me. And she said, I bought this for you to thank you. And I looked at her and I thought, I have never seen you before in my life. and I said, oh, I'm sorry, you have me confused with someone else. And she said, no, I've been sitting in the parking lot for 2 hours waiting for you to come back. She said, you're the right person. I need to thank you for what you did for me yesterday. And I'm thinking, 50-pound fruit basket, I must have done something incredible. And I'm thinking, what did I do yesterday? What did I do yet? Nothing, I came up blank. And I kept insisting, I'm the wrong person. There's somebody else that deserves this fruit basket. And she said, no, when you made that phone call for me, then I remembered, all I did was make a phone call. She came into the health department lost, confused. She had her little son with her. She was supposed to get a developmental evaluation. She didn't know where to go. She had been to 2 places already. They said, no, not us. I think maybe you need to go here. And they sent her to the next place. She was late for the appointment. She had waited 3 months. She was scared. She was confused. She was frustrated. I said, well, let's make a phone call and find out where you're supposed to be. So I sat her down. I gave her son my coloring book and crayons. And I called a couple of places, found out where she was supposed to be, which was right next door, sent her on her way. I forgot the whole thing. To me, it was no biggie. To her, it changed her world. You're going to do things like that every day as a nurse. They're going to mean nothing to you because it's what you do. But to somebody else, it's going to make a huge difference. I have cried with patients, literally cried with patients. I have prayed with patients. I have cared for patients. These are people that have real worlds that you can impact. For some of you, your world will be a little bit bigger. You'll have staff to manage, and the staff will become your world. For others, you'll branch out into your community or into politics. Your world will get bigger. Wherever your world is, be a world changer. Don't sit back at the end of the day and think you got your job done just because you got a paycheck for working 80 hours. You haven't done your job. If you haven't been a world changer, you have not done your job. It's not easy making change. And I have gone through my career being a little bit of, not exactly a hothead, but kind of like Dr. Lufkin, I don't always like to follow the rules, as they found out around here. I never intentionally break them, but sometimes rules are just really stupid. But you have to break the rules in the right way, and you have to go through the right process. You can't just go around breaking rules. But what I learned through 40 years was, what I was doing was approaching a problem with all of my zeal. I still have tons of righteous indignation, and just ask me on any day and I'll tell you what I think. And I can approach a problem and I'm gonna go right in, and I'm gonna get that problem. And you know what happens? Nothing. Nothing changes. Nobody's happy with me, nobody listens, nobody likes me, because I'm attacking them where they hurt the most. I'm attacking them at their weakest point. When tempers are flared, when people are angry, when emotions are all zinging around, I have learned a better approach, another prop. I only have 3 balloons left. All right, I have learned that if you want to be a world changer, you can't approach people where they hurt the most. You've got to go in the back door. So let's see if I can actually get this knitting needle to go through this balloon without popping it to death. Well, if you're going to go in the back door, you're going to talk to people in a way that isn't intimidating. You're going to rally the forces. I think this one's going to pop. You're not always successful, but sometimes you are. And it's worth a try. You don't do it the first time, you go to plan B. There's always a plan B. All right, little green guy, you're plan B. We're going to go through plan B here, and we're going to try another approach. We're halfway there. Halfway is good. Oh, I'm losing the air in this one. All right. And even though we're losing the air, it works when you're not losing the air. You can get the knitting needle through the balloon. You can resolve problems. You just don't hit people where it hurts. You use a little more tact and finesse. All right, I think that we have better things to do than to listen to me talk. And I think there are some pins that we're supposed to be giving out, which is really what you came for. But just remember this, in 40 years, I'll be back. I'll be back.
The next portion of our program is the presentation of Students' Awards for Excellence. There are 3 awards. The first award goes to a pre-licensure student who has the highest GPA and has been academically accomplished throughout this program. The student with the highest GPA is Brooke Brown. Dr. Annie Muller will present the second award, and Mrs. Regina Smeltzer will present the third.
Boy, you guys are good. This is the Sylvia Lufkin Award. Dr. Sylvia Lufkin was the visionary leader who began the BSN program here at FMU. She exemplified competence, caring, and commitment. These noble qualities have been the foundation we strive for in all the nursing students. All of our graduates, all of our graduating students exemplify that philosophy. Sadly, only one student can receive this award. So it's with great honor that I present this award to Miss Elizabeth Ferraro.
I told you I'd be back. I have 2 awards. I have a Public Health Award and a Leadership Award. The Public Health Award is for a public health project that makes an impact in the community. The RN to BSN students have to do a public health project after they've done an assessment of their community. The project doesn't have to be implemented. However, many of the students do go ahead and implement their projects or have been through a process enough that they have the support to implement their projects. This project was noteworthy because it was implemented, and it was impactful, and it was different. This project was to serve the homeless people in Myrtle Beach. And you know as well as I do that the homeless people are the invisible people. You know, what do you do when you see a homeless person? You turn your head so that you don't have to face the fact that there's somebody there that you should be doing something about. And homeless people are invisible people. This student prepared a public awareness event to help the public to be aware of the plight of homeless people in Myrtle Beach. He also developed a list of resources available to the homeless population. This award goes to Paul McKnight. I chose Paul because he's sitting in the middle of the row and I knew it would take him forever to get out. The second award is a leadership award, and in their leadership class, the RN to BSN students have to work with a nursing leader, and they have to do a meaningful project. This project needs to take them about 80 hours, so that's a good hunk of time. And these projects have to be valuable to that nurse manager, something that the nurse manager would do if that nurse manager had the time to do it, which they don't. This student chose to work on a condition that kills about 300,000 U.S. citizens every year. What he did was prepare an educational program on thromboembolisms, and was able to prepare this presentation and share it with the staff members, requiring them to attend this refresher on thromboembolism. Because of that, the hospital now has a new awareness of prevention and better statistics, which means a whole lot to me when I'm going to go to that hospital, and I'm sure it will to you too, that I'm probably not going to die of a thromboembolism in our local hospitals because of this student. This award goes to Joseph Sandy.
Thank you. Now we will move on to the pinning of our students. The students' names will be read by Mrs. Vicki Martin. The RN to BSN graduates will be pinned by their director, Mrs. Regina Smeltzer.
James Edward Anderson.
Kenneth Scott Bennett.
Tracy Thurman Davis. Cynthia Levitra Davis. Elizabeth Banks Ferraro. Adam Michael Dooley. Brittany Ann Hale. Lauren Bell Haynes. Tamika Antoinette Henry. Jason Owen Hewitt. Ann Holiday. Shanika Latrell Holland. Daniel Jordan Holmes. Megan Ann Howard. Holly Colleen Hunt. Lindsay Marie Jackson. Katrina Jabali Yost. Mikhail Alexandria Johnson. Robin Kimberly Kerbin. Brittany Leanne Langley. Brittany Nicole Lawson. Elizabeth Halcyon Lee. Justin Ray Lupo. Jessica Lynn Martin. Morgan Kayla Mattingly. Emily Elizabeth McGee. Hannah Elizabeth McKenzie. Elizabeth Margaret Morgan. Kim Renee Nestor. Caitlin Patricia O'Brien. Lacey Nicole Paget. Caitlin Stone Poston. Trey Gasquey Poston. Dita De Vera Ramos. Tanisha Siobhan Richardson. Farrah Arnett Rock. Tanya Schultz. Amber Michelle Sherritt. Jennifer Lee Smith. Laura Brooks Smith. Lauren Weta Taylor. Tracy Johnson Till. Megan Joan Wallace. Amber Taylor Walters. Macy Nicole Way. Chelsea Ann Yarborough. Cynthia Louise Canty. Denise Jacobs. Wesley Jacobs. Paul McKnight. Joseph Sandy. Now let's give all of the graduates a round of applause.
Thank you. At this time, we invite all the nurses in the audience to stand and join us in reciting the nursing pledge. As I enter the nursing profession, I pledge to use all the knowledge, skills, and understanding that I possess in providing professional nursing care, deliver nursing care non-judgmentally, and to all those who require it to the best of my ability. Refrain from any action which might be harmful to the quality of life or health of those I care for. Treat each patient with respect. Hold in professional confidence all the personal information entrusted to me. Keep my professional knowledge